Greetings, everyone. It's Health and Family time again. Shay here with you, and I think we have an interesting topic today. Does anybody remember the commercial back in the 80s of the lady who was completely stressed out? I know I'm aging myself. The premise was about a stay-at-home mom trying to cook, deal with the children. The dog is barking incessantly, and then the mom just screams at the center of her kitchen, grabbing her hair and saying, "Calgon, take me away." I remember that ad so distinctly because every time it came on, my reaction would always be the same. For goodness sakes, girl, you need some help and you need it fast. And then you would see her laying in a tub and it seemed that all of her stresses just seemed to melt away. Joining me today is the Executive Director from the Employee Assistance Program, Mrs. Doris DeCosta. We welcome you to Health and Family.
Thanks for having me.
Do you remember that commercial I was talking about?
A little bit.
Vaguely?
I don't want to age myself, but I remember some of
I'm
it.
the dummy on set. Okay. So, well, let's start off with what is the Employee Assistance Program? I know that's a big general question, but
Well, the EAP, I always try to think of the EAP as a benefit to employees, which it is.
Mm-hmm.
An employer would pay for us to provide counseling services to staff, just like health insurance.
Right.
It's a benefit in the same kind of vein. But only good thing is when you come in, you don't have to do a copay because your employer pays everything. But it's a industry-based counseling program that people can come in and, talk about their issues. Like the lady that was stressed out, she might have been a spouse of an employee.
Right.
She can also come in and access the program because it's eligible to employees, their family members, and their children.
Is it just government employees or is it anybody?
It's not anybody. It's mostly employers who sign on with us as part of our membership. And we have a membership of right now, 216 employers who have joined the EAP.
Yeah.
Government is one, but the government is one of many.
Got it. I didn't know that. I just, for some reason, thought it was a government thing. So can you give us a brief history of EAP here in Bermuda? Because it is a international
It's international.
Yeah.
There's EAPs in a lot of different countries, America, South Africa, England, a lot of places. But in Bermuda, EAP started in 1987. And it really started out of a government report that was commissioned to look at substance abuse. And out of that, they found that most of the people who were drinking alcohol and using substances were working people. So to address that, EAPs came out of that.
That makes sense.
Yeah, EAPs. And I think it was a great movement.
Right.
Because I think at that time we had more, well, I don't want to minimize the drug problem we have now, but at that time the drug problem was very pronounced, I would say. After that, there was a group of employers who got together to create the EAP. They decided to put together a consortium model, which is a group of employers come together as a membership to buy into the EAP, so to speak. There were a number of big employers, actually, government, the banks, and several others. And out of that, the EAP came, started.
I think it's a great idea. I really do.
Yeah. And many of them are still with us today.
Cool.
Yeah.
So what type of problems, because I know I was sharing with you a little earlier, my first year of teaching, it was very, very, very stressful. And I do remember going to the EAP. I believe you were located then on Front Street. Correct me if I'm wrong.
We were.
Okay.
We've recently moved to Church Street across from City Hall and the mall, which is very convenient for the staff and the clients and everybody. So it's been good. We were at Front Street, at the end of Front Street,
I remember,
Front and King Street for maybe 28 years.
I remember that.
Yeah.
So what side? I went because it was my first year of teaching. It was very stressful. What other problems do people come to EAP for?
Well, currently, I would say the three presenting problems that seem to stay consistent throughout the time that I've been at the EAP, and I've been there 7 years, is marital relationship issues, work-related problems, and emotional, psychological problems. Of course, we see people with substance abuse issues, grief and loss, and I say other too, because you just never know.
Right.
I've even counseled somebody who lost a cat, you know, and it was pretty serious for that person. People might laugh, oh, what's that? But for that person, it meant a lot. Just an array of problems that we deal with. And I must say, no problem is easy. I've noticed over the years that a lot of the problems that people come in to talk about are very complex problems. And we have to have a good complement of people to deal with those type of problems. Because you might come in saying, oh, I'm got an alcohol issue, but then when we start to talk to you, it's spilled into the family, it may have spilled into their jobs. So it's very complex issues that we deal with.
And I guess that leads me to my next question as to what kind of qualifications would an EAP counselor need to have in order, because like you said, the complex, yes.
Yeah, for us, I like our staff are master's level or better, because you need to have some clinical experience, at least 3 to 5 years clinical experience. I think we have a great staff. We have one person who is our clinical specialist in substance abuse. Another person is a specialist in marriage and family therapy. I'm pretty much a specialist in crisis intervention and organization development and issues with organizations. Another person is good at domestic violence issues. So we have an array of staff, but most of them have to be on the master's level. They're licensed professionals, and I have to say kudos to my team.
Okay.
Yeah.
Now you deal with a crisis intervention. What does that entail? And without giving out to, I don't want anybody's.
Well, sometimes what happens is it might be crisis with individuals who come in. For example, unfortunate, it might be a gun violence that have occurred. Somebody's son or daughter might have been shot. The company might feel concerned. They may refer the person, or the person may come on their own. So, you know, we help deal with that type of traumatic event. Sometimes there are crises that happen within a company. It could be a downsizing. It could be the person who had the shooting might have had a big role to play in the organization, so people might have been impacted. So there's a lot of different things that may happen in an organization. Violence could occur in an organization. So when we go in, we try to assist companies to deal with that. We'll sit down with them, look at what type of plan they have in terms of handling a crisis, because some companies already have plans in place in terms of how you manage a crisis in your company. Some of them don't, so they kind of look to us to say, is this a good thing to do? Is that a good thing to do? Okay.
Let's talk about confidentiality, because I would think that would be very, very large on your radar screen. Talk to me about, because I'll be honest, if I'm coming to you, I don't want you saying, oh, well, Shay Dawn's got an issue with such and such. Can you just elaborate on the confidentiality?
Well, confidentiality is big for us, because if we don't keep it, we don't have a program.
Exactly.
So we do a lot of things to try to help people feel safe and comfortable and confident in the confidentiality that exists with us. We have 2, or I would even say 3 separate waiting areas, so people don't run into each other. We have certain protocols in place in terms of how we may call you, because we don't just call you at your house. We can't, because some people may not be telling their spouses they're coming to the EAP. So we have to ask you, how can we contact you? What's the best way? Give me your number. Is it better at work or at home or what?
Text.
Yeah. So confidentiality is very important to us, and anytime somebody comes on to work with us, we have them sign confidentiality oaths.
Wow.
Because it's really important. You got to remember, we live in Bermuda.
I was just about to say.
And people really feel funny about that. That's why, and that's one of the barriers for people not coming, because they feel that, oh, I don't know if they're going to be confidential enough. Yeah, we hear that a lot.
Now, under what circumstances can information about me be disclosed without my permission? If you said confidentiality is large, but is there a time when you may have to say, well, Ms. Burgess,
If you're a harm to yourself or others, we may have to say, look, we need to contact somebody to help you and to help us too. But those are some of the issues that we would have to violate the confidentiality.
Okay, so
Yeah.
harm to myself or
Yeah.
others. So the information that I talked to the counselor at EAP about, is this put into my employment file, or how does that work?
We don't have access to your employment file
Okay.
at work, and we encourage most employers or every employer not to include EAP information in their file, because sometimes you might decide, oh, I want to move up the ladder and go a certain place, and some people might, if they have some document in your file that says you've been to the EAP, some people might say, she went to the EAP and she probably got some issues.
Right.
So we try to discourage that. We keep our own files at the EAP, but in terms of your employee, we don't have very much control over that.
Okay. So I guess it would be up to the person to not necessarily tell their employer that that's part of what they're going to be doing, going to the EAP, because it's really none of their quote unquote, business.
Well, there's three streams in terms of coming to the EAP. You can self-refer. That means you come on your own, nobody knows, they don't have any idea. Then people are referred through their manager or supervisor or HR. And when that happens, they do have a form they have to fill out to kind of give us information around what's going on with the person, why they want to refer them. Generally, they have to sit down with the employee after they fill it out and talk to them about why they want to make the referral, what's happening with them, what their expectations are in terms of making the referral and things they would like to see happen after the referral's done. So that's one way. And that, since that's a document, that might go in your file. It depends on how your company wants to handle it. And then we have compassionate referrals. You may be doing okay at work, but they may have picked up that you're a Calgon girl, take me away, you're stressed.
You do remember that commercial. I'm not the only one.
So they might suggest that you come. You could be doing okay, but they kind of pick up that something's not right with you. So they might say, hey, what's going on? You might say, oh, I'm having some little issues with my kids or my husband or whatever, and they might compassionately refer you. There's no paperwork involved in that. It's just it's really like a self-referral.
Okay. Now, you mentioned that, is there a cost to go to EAP?
There's no cost. There's no cost. No copay, because your employer's paid it all. Yeah, so you don't have to pay anything. And I think it's great, because when you think about it, if you have to go to counseling privately on the island, it could cost you well over $250 an hour.
Wow.
So if your employer has got this benefit for you, it's a real saving for you. We see people from 6 to 8 sessions, which is great, right? It's free,
right.
So you could come in, get those sessions. Whatever we can't do in 8 sessions, we'll refer out to someone. But generally, I found we do very few referrals. Most people are able to resolve their issues within that 6 to 8 sessions.
And if not, you will refer out to another
we'll
agency.
Try to look at what's the best cost saving for you before we refer.
Alrighty. Well, we're going to take a break, and we'll be right back. Stay tuned.
Healthy people and healthy communities.
Keeping active reduces the risks for diabetes, heart disease, arthritis, and stroke. These conditions can limit your lifestyle, but they are preventable. Exercise and a healthy diet are good for all ages, so make them a part of your daily life. Walk more often. Take the stairs instead of the elevator. Leave the car at home sometimes. You'll be amazed how easy it is to be more active. Get on the move to a healthier you. This is a message from the Department of Health.
And we welcome you back. Mrs. DeCosta is our guest today, and she's giving us the ins and outs of this dynamic organization, the Employee Assistance Program, commonly known as EAP. So, Mrs. DeCosta, you were giving us sort of an overview of the EAP, and so let's get to the nitty-gritty. Give us how would you be the one handling the crisis situations in the workplace? Give us a little bit of example of that, if you could.
I was thinking about, and unfortunately I hate to bring it up, was when we had the murder at the chamber many moons ago, many years ago.
That, yeah.
And EAP, I'm assuming, had to come in and do some crisis intervention.
Yes.
When you go into an environment like that in a company, it's so many things that you have to really look after or assist a company with. Like, how do you manage the staff? What things do you do? What things can you do to help them move forward? Is it safe or is it a good idea for them to return back to an environment that something like that occurred, what does the CEO or the other people in senior management, what responsibilities do they have, not only to the staff but to their customers, right? How do you handle the media? How do you who should you refer to EAP after a crisis like that? It's just so many things that you really have to look after in a crisis.
And I was just thinking, you were talking about that. I would think maybe a suggestion, maybe to the employers, if a situation like that happened, was maybe we could have the individual work from home for a little while and then kind of work their way back into the system.
If that's possible,
Right.
that could work.
Yeah.
Or they might have considered having another location, because sometimes people have business continuity plans that would help them. They might have a place already identified so that people can go and where they can go and work, if something happened at the company.
All right. So let's talk about an individual actually getting fired from a job. Without a doubt, very traumatic. How would you guys handle that at EAP?
Well, we get a lot of requests for that, particularly in the last couple of years when we've had a lot of downsizing and stuff. A lot of companies call us in for support. And sometimes I think it's more support for the people who have to do the firing, because it's not an easy situation to do. But we come in to sit after they give the bad news. So if somebody wants to talk about it, we're available. I find a lot of people don't want to really talk. I think in all the last 5 years or so, when I've gone out to companies who've done downsizing or redundancies, I maybe had one person. It's generally after they've had the redundancy or firing that they may call the EAP. We offer 4 sessions after a redundancy because people, it's a shock, but they don't want to talk about it. They just want to get their belongings and go.
Usually upset, I would assume.
People are upset, but they don't really want to talk about it. They may, if they have a good HR, and I find most of the HR people are very sensitive to that, because that's a very difficult task to do. But I find that people will come to us during that, after, and take advantage of the 4 sessions.
Okay.
Yeah, because people are stressed after they have time to catch themselves and really think about what's happened to them. They say, you know what, I need support. I don't really know which way I need to go. Who do I go to talk about a resume? And things have changed. What I found too is that with a lot of the redundancies, a lot of older workers. So sometimes some people don't really know how to, for example, put their resume online or download whatever. So a lot of people need help with that.
Well, that's
So we refer them to people who can assist with that, because it's a different world.
It is. Would you assist with helping the person get another job?
No, we don't have time, unfortunately. We're just really swamped with clients, so we make referrals. We just don't have
But
the time.
you would make a referral and say maybe you may need to go check out so and so.
Reach out to this person.
Okay. So how do you work with managers and directors on individuals, regarding individuals who are having a problem with their performance on their job?
We do management consultations. That's a service that we provide. For example, if a manager, and I get calls like this almost every day, I have so-and-so employee, I'm not sure which way to go with it, I don't want to make mistakes, and I'm trying to really help the person, because I think some people kind of perceive managers or supervisors as these bad people. But there are people out there that really do care about their employees and employees succeeding. So a lot of them will ask me, what you think about this? You think I'm going in the right direction? What's the law say? Because people have to act or behave within the law. The Employment Act is not there for nothing. So, they may ask questions around that. How do I approach this? And sometimes I also give them a little counseling too around, how is this impacting you? And I know this person might be a pain, but, hang in there,
Empathy
yes,
goes a long way.
yeah, because I know that, people don't realize when you're a manager and you supervise people, it's a hard task. You're dealing with a lot of personalities, and if you have a large staff, that's even even bigger job, dealing with all these different individuals.
And so if a person is experiencing alcoholism or drug usage, how would you intervene in that instance?
Well, we get referrals from, most of the time we get referrals from managers or supervisors with that. We do get a number of employees who come on their own. But generally, if you have an alcohol problem, we'll do an assessment. We use an Audit C. Most EAPs use Audit C. And it really looks at risk. What's your risk in terms of your alcohol use? Is it extreme? Is it severe? That gives us an indicator in terms of whether you're really going to be an alcoholic or where you stand with your alcohol.
Is this a survey thing?
It's a survey we use. It's a what I would say it's a tool. It's a diagnostic tool that all EAPs use to determine your risk in terms of your alcohol. Once we see the numbers, then we have what we call different things that we kind of give employees. Well, like we of course you have to go to BARC, because in Bermuda, in order to access alcohol services, you have to go to Bermuda Assessment and Referral Center, commonly known as BARC. So we make those referrals. We make referrals to Pathways. We make referrals to a number of different agencies who assist employees. In terms of the drugs, we also have different tools that we use to just survey people in terms of their drug use. But BARC is helpful because they help us to determine the level of care that somebody would need.
Okay. And so you've been in this industry for about 7 years, you said?
I used to work at the hospital. I did the EAP at the hospital, which was an internal EAP. There's different types of EAP. This model is a consortium model or considered an external EAP, but at the hospital I did an internal. So I did that for
Just in the
15
hospital.
years.
Oh, okay.
And then I transitioned eventually to the EAP. So I've been in the field maybe close to 25 something years.
So the reason why I asked, I wanted to know what major changes have you seen? I guess we could talk from the hospital to today. Things are just going on constantly. Talk to us about what was really prevalent back 20 years ago to today. What is now the hot thing? Or
Well, to be honest with you, the same three problems I mentioned earlier, marital relationship, workplace, and emotional psychological, same problems then. It's same. Different, I think, from when I was at the hospital, gun violence wasn't so prevalent.
Okay.
That's the big issue, I think. Gun violence, and also I think we need to pay more attention to families.
Yes.
What's happening in families? How are we managing families?
Yeah.
What's going on? What's the dynamic? We get a lot of people that have divorces, a lot of people having issues with blending families. We have a lot of people who are sort of cohabitating together that have issues and they have children.
Right.
What are we doing with our children, right? And I think what's cropping up it may take over the work-related, because that's the third one, is the family. That's the big change that I see, is we're dealing with a lot of family issues and how people are managing their relationships in those families.
a lot on relationships, just
Yeah.
basically relationships.
Yeah.
And so we were talking about, is it a growing field in Bermuda, the EAP, the employee assistance?
I would like to see it as a growing field, and one of my things on my wish list is to try and start training Bermudians to be in the field.
Okay.
We do have a Bermudian staff, and I think that's great, but I don't think a lot of people are trained in EAP because it's a different type of practice rather than just counseling. It's a practice in counseling.
Okay, yeah.
So if I can get people to come in and do some summer internships and stuff like that, that would be wonderful. I'm working on it because I do get a lot of requests for people who want to come in, but because of the nature of how we do our business, it's very hard to say you're counseling with me and I got somebody here sitting listening.
Yeah.
A lot of people are not going to be wanting to do that.
True, yeah.
What's great that's happening in October is the Employee Assistance Professional Association will be having some workshops on how we bring young people into the fold, and I'm happy about that one.
Well, how do you bring young people into the fold? Let's talk
Well,
about that.
right now I can't because of the setup. I'm trying to look at how I can use a young person at the EAP, either research or some project that I can do. That's the only way at this point. But in terms of the counseling, that's a whole different ball game for me, because I know that when people come in, it's hard for people to, number one, call up the EAP and say, you know what, I really need to come in and talk to so-and-so. That's hard for people to do, and then have the extra dynamic of having this extra person in.
No,
so
I
I
agree
have
with
to I have to really sort out how that would work.
Yeah. A thought just came to me. So if I'm coming to visit you and I have an issue, can I pick who I want to go see?
Sure.
As a black female, I could say I really feel more comfortable with a black female, or how does that work?
Well, we have a website, and a lot of people do go to the website to see who the counselors are. We don't have pictures, but we do have bios of all the staff. So sometimes they'll say, I want Doris DeCosta, I want Lauren Trott, I want Letitia Lister Burgess, I want Nina Wilson, I want Arlene Swan. They will say, we don't have any males on staff, unfortunately, but they'll say, look, I have depression, I need somebody that can really deal with that. So yes, and even if you go to somebody and you say, I'm not connecting with Ms. DeCosta, I think I want another counselor. I'm not hurt because I really want you to get the help. So yeah, you could pick and choose.
All right, that sounds good. Any final words on EAP? This is your chance to sell
I just
it.
want to say this is our 30th year in Bermuda.
Oh, cool.
What a great milestone
Yes,
for the EAP.
without a doubt.
Yeah, and I think that's a testament to the service that we provide. This year I did a member company survey. Most or all of the persons who responded felt we did a great job.
Good.
And we're an accredited program. We are the only accredited EAP in Bermuda, and I'm really proud of that.
All right. Thank you so much for joining us.
Thanks for having us.
You're more than welcome. We really want to thank Mrs. DeCosta for sharing a considerate amount of information on this topic. Let's face it, while some may think they're Superman or Superwoman, reality dictates that it is okay to feel a little overwhelmed and seek help. There is no law that I know of that says you can't reach out to someone for reassurance that it's going to be okay. Yes, you can talk to a friend or a family member, but you may feel more comfortable sharing your inner thoughts with a complete stranger who is bound ethically to keep it confidential. Sounds like a good deal to me. So the next time it gets too much for you, make EAP a part of your solution strategy session. On behalf of the team, I'm Shay Burgess, and this has been Health and Family.